Hello. Today let us learn the stomach. Stomach is the most descended part of the alimentary canal. It continues from the esophagus, and the lower part continues as the duodenum. As the duodenum. Okay. Now, you know, before describing any organ, we start with the location where exactly the viscera is situated in the abdominal area. The anterior abdominal wall is divided into 9 quadrants. Okay, we have the epigastrium, then comes the umbilicus, hypogastrium, then we have the hypochondrium, right and left hypochondrium, then we have the right and left lumbar region, and here we have the iliac fossa. Okay, from this diagram you can see that the stomach lies in the epigastrium, umbilicus, and the left hypochondrium. So you can see located where it is situated in the epigastrium. Epigastrium. Now we have the umbilical region and the left hypochondrium. There is a location of the stomach, and normally the shape is, it is a J shaped organ. Shape is mostly J shaped. And what is the length of stomach? 25 centimeter. These all used for, you normally asked in viva examinations. 25 centimeter long, and what is the capacity is 1.5 to 2 liter in adult. That is the capacity of stomach. Now let us see the external features of stomach. External features. What are the external features of stomach? So here is a diagram. You can see it has got two ends are there. The upper end is the cardiac end, and the lower is the pylori. Two ends are there. Two ends. We have cardiac end and pyloric end. Cardiac end and pyloric end. Two ends are there. Okay, and there are two curvatures. So here we have the lesser curvature, and this is the greater curvature of stomach. Lesser curvature, we have the lesser curvature and the greater curvature. Greater curvature is the right border, and the lesser curvature is the left border. Okay, so two ends are there, cardiac end and the pyloric end. Then two curvatures, we have the greater curvature or the right border, lesser curvature or the right border, greater curvature or the left border. And two surfaces are there. They are antero-superior surface. Antero-superior, not the anterior surface, but the antero-superior surface, and postero-inferior surface. Postero-inferior surface. Then again, you know that the cardiac end or the upper end joins the lower end of esophagus. And the orifice is known as the cardiac orifice. This opening is the cardiac orifice. And the lower part, the pyloric end, there is a pyloric orifice, and the proximal end of the duodenum joins the pyloric orifice. Proximal end of the duodenum joins the pyloric orifice. Now this cardiac end, cardiac end of the stomach lies left of the median plane. You remember, left of this median plane. If you make a median plane, left of the median plane, this, suppose this is the median plane. Okay, left of this median plane at the level of T11. Remember this vertebral level at the level of T11, whereas the pyloric end lies right of the median plane. At the level of L1. Okay, you know the peculiarity of the L1, that is the transpyloric plane is passing through. Transpyloric plane. Remember this one, transpyloric plane. Okay, the pyloric end of the stomach lies right of the median plane at the level of L1 vertebra. Again, the cardiac end, there is a physiological sphincter. There is no anatomical sphincter. There is a physiological sphincter. And at the pyloric end, there is an anatomical sphincter. Is present at the pyloric end. of the stomach. Now now let us see the parts of stomach. Parts of stomach. Here we have the esophagus. This is the duodenum. Okay, so this is the cardiac end of the stomach, cardiac end, and here is the pyloric end. Okay, and this part of the stomach, the most uppermost part of the stomach, is known as the fundus. Here is the fundus. This is the body of the stomach, and this is the pyloric part of the stomach. It's known as the pyloric part of the stomach. And here we have the greater curvature, and here we have the lesser curvature. Okay, now we're going to learn a new term that is known as the incisura angularis. Incisura angularis. What do you mean by incisura angularis? Incisura angularis is the most dependent part of the lesser curvature. If we see, this is the lesser curvature, the most dependent part of the lesser curvature is known as the incisura angularis. Okay, and it indicates the junction of body and pyloric. Junction of body and pyloric part. Body and pyloric, that junction is known as a incisura angularis. Okay, then we have the greater curvature. Okay, greater curvature gives attachment to the greater omentum, and we have the lesser curvature gives attachment to the lesser omentum. Lesser omentum. This uppermost part of the stomach is known as the fundus of stomach. Okay, and normally the fundus of stomach lies below the left fifth intercostal space. The left fifth intercostal space, stomach is more on the left side. The fundus of the stomach lies below the left fifth intercostal space, and sometimes the pain of the stomach mimic the angina pectoris. Angina pectoris, that means the pain over this left fifth area mimics the pain of cardiac pain, angina. Okay, chest pain. And normally the fundus is distended with air or gas, which is clearly seen as a radiolucent shadow under the left dome of the diaphragm in a skiagram. Okay. Now let us see a new term, that is Trobe space. What do you mean by Trobe space? Okay, you can see, so here we have the left lung, and this is the spleen. Okay, and this is the costal margin. You can see costal margin, and here we have the liver. Okay, so Trobe space is a small space which is bounded by the inferior border of the left lung, superiorly. Okay, and inferiorly we have the left costal margin. To the left side we have the spleen, and to the right side we have the inferior border of the left lobe of liver. Okay, again boundaries, we have superiorly the lower border of the left lung. Okay, inferiorly by the left costal margin. Okay, onto the left side by the spleen, lateral end of the spleen, onto the right side by the inferior border of the left lobe of the liver. What is important? Below this area, the fundus of stomach lies below this area. Fundus lies below this area. So normally, what is the clinical significance of this Trobe space is, it is normally this area is tympanic on percussion. We get a tympanic sound on percussion because the fundus of stomach normally filled with the gas. Okay, now what is important? Even in case of splenomegaly, so splenomegaly first happens in this space. Okay, or any inflammation of the liver, lower border of the liver, or any abscess in the costodiaphragmatic recess of the left lung. Okay, so on all these cases there is a dull sound. We get a dull sound on percussion. What are the cases? In case of splenomegaly or inflammation of inferior border of left lobe of liver, or inflammation of the left costodiaphragmatic recess, that is the Trobe space and its clinical significance. Now let us see gastric triangle. What do you mean by gastric triangle? Okay, so gastric triangle, it's a triangular area of the stomach that is in contact with the anterior abdominal wall. It is bound on left side by, see here, these are the boundaries. I'm just making, see, this is the gastric triangle. You know, this is the left costal margin, margin left costal margin. On the left side by the left costal margin, left side it is bounded by the left costal margin, then on to the other side, right side, this is the liver. On the right by inferior border of liver, and this is the transverse colon, and inferiorly by transverse colon. So these are the boundaries of gastric triangle. What is the importance of this gastric triangle? There is a procedure called gastrostomy. That means there is a surgical insertion tube in stomach. It is performed through the gastric triangle. Okay, so the food pipe, in case of any problem, so the food pipe is inserted through this triangle into the stomach. Okay, in case of esophageal obstruction, gastrostomy tube is inserted through this triangle into the stomach in case of esophageal obstruction. Okay, so that is a gastric triangle and its clinical importance. Now coming to the body of the stomach. So body is the distended part of the stomach, and the last part is known as the pyloric part. Okay, pyloric part, the proximal part is known as the pyloric antrum, and the distal part is the pyloric canal. Proximal is the pyloric antrum and the distal part is the pyloric canal. So pyloric canal continues as the duodenum. Okay, as the duodenum. Now let us see the relations of the stomach. So relations are discussed under peritoneal relations and visceral relations. So first start with the peritoneal relations. What are the peritoneal attachment of the liver? Then the stomach, we have the lesser curvature. On the lesser curvature we have the lesser omentum. Is attached. This is the lesser omentum from the stomach. This is the lesser omentum. And on the greater curvature we have the greater omentum is attached. So here we have the greater omentum. This is the greater omentum. So the greater omentum we are already discussed earlier. Then so we have the lesser omentum, then comes the greater omentum. So this lesser omentum, greater omentum is already discussed. If you did not watch the video, please go and watch the video of the descriptions of these ligaments. Then another ligament is known as the gastrosplenic ligament. Here we have the spleen. Okay, we have the spleen is attached, is related over here. So this part is the gastrosplenic ligament. Gastrosplenic ligament. Okay, and above we have the diaphragm. This part is known as the gastrophrenic ligament. Gastrophrenic ligament. So these are the peritoneal ligaments, relations of stomach. We have the, once again, lesser omentum is attached along the lesser curvature, greater omentum is attached onto the greater curvature, and between the stomach and the spleen we have the gastrosplenic ligament, and the uppermost part we have the stomach, and the diaphragm we have the gastrophrenic ligament. Then coming to visceral relations. What are the visceras related? Visceral relations. Anterior and posterior. Anteriorly, the anterior abdominal wall. Then we have the left lobe of the liver, and posterior relations is known as the stomach bed. Normally asked for examination, stomach bed. What are the structures forming the stomach bed? You can see in this diagram, we can see we have the diaphragm. Already we have the diaphragm. Then this is the left kidney, left suprarenal with suprarenal gland. Then we have, this is the pancreas. You have the pancreas. Then we have the transverse mesocolon. See the transverse mesocolon. Okay, so we have the transverse mesocolon. Then is a left colic flexure. We have the left colic flexure. Then we have the splenic artery. See the splenic artery, and we have the spleen here. Now the spleen. So these are the structures forming the stomach bed. Let us see one by one. So we have the diaphragm. Okay, then we have the left kidney, left suprarenal gland. Then we have the transverse mesocolon, then the pancreas, then we have the splenic artery and the spleen. So these are the structures forming the stomach bed or the posterior relation of the stomach. Then internal features of stomach or the gastric mucosa. What is the peculiarity of the gastric mucosa? The gastric mucosa is thrown out into folds. That is known as the gastric rugae. Okay, and you can see that in this diagram, the gastric rugae, this is a lesser curvature. Along the lesser curvature, the gastric rugae are longitudinally arranged. That is known as the gastric canal. Okay, this is the gastric canal. Okay, the gastric ulcer more happens along the lesser curvature. Okay, this gastric ulcer happens more along the lesser curvature. What is the reason? Occurs along the lesser curvature because of this gastric canal. That means mucosal fold are longitudinally placed, so the food materials or any structure, anything what we eat is more likely to travel along this lesser curvature. So the mucosa is highly exposed. That is why these gastric ulcers are more likely to be occur along the lesser curvature. Now let us say the blood supply of stomach. Stomach develops from the foregut, and the artery